this?
Yes, no, thank you. So, yes, it's a mental health day today, but actually I'm going to talk about physical health, so just to be refreshing at the end of the day. So really just to remind everybody, our health is actually a component of physical and mental health, so it is important we can combine the two. So just before we start, I think we're probably more familiar with people with long-term conditions, with cardiovascular disease, diabetes, and we will ask them, do they suffer with anxiety or depression? We recognise there's a strong link with a long-term condition with mental health for those with physical disorders. It's the same the other way. We've got to think about those with long-term mental health conditions and their physical health. So I think that's really what I want to talk about today. Whilst we may have people with very severe mental health illness, let's not forget about their physical health. So really what I want to talk about today is the physical health impact of those with serious mental illness. And really I'm just going on the QOF definition for serious mental illness, and these are the three main conditions. So we all should have QOF mental health registers, and this is who should be populated on there. So it's about what is the impact and the case for change for improving physical health in this group. So for me, this is the strongest, really poignant fact. Basically, if you do have a serious mental illness, you are more likely to die prematurely, 15 to 20 years prematurely, by having a serious mental illness. And this isn't actually the impact of the mental health illness, it's the physical health. So it's not that they're more risk of suicide, although that is the case. It is actually from dying from cardiovascular risks in particular, and from diabetes and other long-term conditions. So these are preventable deaths in people with SMI. So I won't go through absolutely all of these, but these are the sort of the risks for people with SMI. Basically, it's double if you've of diabetes if you've got SMI, and as you can see moving down, your risks go up. To me, the most important one to be aware of is that 40% of people with SMI are likely to smoke. And actually, if you're going to choose one area to actually really address, that would be the one to look at. Number one, ask them, do they smoke? And two, actually really be proactive about intervening. So this is of course recognised nationally, and the Mental Health 5-year forward view is really looking at trying to really balance this inequality. And really as a point of that, they have recognised that actually in general practice we see a lot of people with serious mental illness or SMI, and there's an opportunity there for us to intervene in this particular vulnerable group. So the 5-year forward view had actually given us some targets. And that was by end of last year, is that we would actually perform physical health checks on 30% of those on our registers. And by the end of this year, which is this month, actually in 2 weeks' time, we would have done 60% of those on our health registers. Now, I will talk about how we're doing that locally. I think you should probably all be familiar with a little of it. But do you think we're doing okay? Yes, no. We're doing okay nationally. We're not doing great though. So far, by the end of January, we've got to 21.7%. So there's still a significant gap. There really is. So that's really my purpose today, is really to say, look, this is something we can do something about. I'm hoping it will be a lot better by the end of the month, but that's where we are at the moment. Now I must remember, sorry, I haven't talked about, of course this isn't just a primary care issue, there is a secondary care as well, I'll talk about that in a minute. So the primary care guidance has come out and is basically saying that we should be really looking at screening these people with physical health checks, offering them and really highlighting to them what are their health risks. But we have to remember it's not just screening, it's intervene. Screen and intervene. So yes, you might be able to screen, but please do make sure you can offer the right support for these people. So SMI in Buckinghamshire, well, we're quite a fit, healthy, wealthy population. So just to give you a picture of how we're doing in Buckinghamshire, so we've got just approximately 500,000 patients in Buckinghamshire, and we've got just over 4,000 people on our registers. So that's the sort of numbers that we're talking about. And even in healthy, wealthy Buckinghamshire, there is still a gap. So this is actually a public health figure, but if we just focus on the figure on the left, we can see if you're a man living in Buckinghamshire, you are 20 years, you've been proven to be 20 years to live prematurely by 20 years. And if you're a woman, it is slightly better, but 17 and a half years you're likely to die prematurely, so there is a gap.
To be fair, Buckinghamshire is healthy and wealthy, but the people with long enduring mental illness probably aren't wealthy.
I agree, and that's
might be some of the problem.
Absolutely, I completely agree with that. I don't know if you heard that. So yes, we may be healthy and wealthy, and that was tongue-in-cheek actually when I said that too. But absolutely, those with serious mental illness are actually probably less likely to be healthy and wealthy. So there is inequality there as well. So I alluded to there's a secondary care responsibility, and that remains. So really for anybody with serious mental illness that is under secondary care, they too should be doing a physical health check on all of their people under their care. Now, they don't actually look after all of our 4,000 patients. They probably would look after approximately 10 to 15% of those patients. And really those are people who are unstable, who have just been diagnosed or have become unwell. Once they're stable, and that's usually about a year after having been diagnosed or been established on an antipsychotic, they are generally discharged back to their general practitioner. So this is a joint responsibility. We have a secondary care responsibility, and then we have a primary care for the rest. So in Buckinghamshire, we have we've piloted a pilot this year until the end of March that will roll on to next year. And this was that's looking at these 6 key areas that nationally we've now been asked to target. And what we've been asked is that for each patient, they have each of those 6 parameters checked. So that will include a blood test, looking at cholesterol and glucose, as well as looking at blood pressure, looking at the weight or BMI, and then of course checking on smoking and alcohol. Those are the 6 key factors, and that's actually what's being described within the specification of the director ward. Now there are problems, we have recognised that nationally, and actually that probably does reflect on our 21.7% that I was telling you about. It is a little binary when we do this. So 21.7% of our patients have had all 6 of these. Actually quite a lot of our patients have had 5 or 4 or 3 or 2 or 1. So that is one of the issues. We have looked at it locally, and we do know that blood tests probably are less likely to be done, so that is an area that perhaps needs to be improved upon. And actually, interestingly, smoking as well. So have a little look at that. There is a nationally approved Bradford tool, and I don't know, is everybody using this at the moment? It's the tool we use in Buckinghamshire. It's extremely comprehensive. It's got lots of really good tools in there. Although actually, just to be mindful that actually these are the 6 key areas that we really want to nail. Okay. So we talked about the screening, and then it's the intervening. We're really lucky in Buckinghamshire because we've got a 1-point access, and that's the Live Well, Stay Well service. And actually, they actually would like to prioritise people with SMI. So what that will mean is that they will actually be more, open and encouraging to those with SMI, because we do recognise that this particular group can be more challenging to engage with some of these services. So whilst they still would need to engage with them, they will actually be more proactive about supporting them through this. And that would be for most of the interventions, that's smoking, exercise, weight loss, even alcohol, they can refer on from there as well. The bits that GPs need to look at, which I'm sure you're all familiar with, will obviously be blood pressure control and cholesterol control. But that would be really part of what we would normally do if we did find somebody. You'll probably recognise that the SMI health check is actually very similar to an NHS health check. In fact, it's almost identical to an NHS health check. And I think that's one of the things I would just like to really reassure people. That's really what we're asking, is for a very similar type of check to the NHS health check. So just future ideas really. We've got, it is actually a one model for primary care at the moment, and that is this direct award. Patients come to the practice, they have a health check in a very traditional model. We're in a new world at the moment, and we've got lots of ways that this could be delivered. We also have to recognise that this group may not actually want to come to their GP, they may not engage with their GP, so we do need to think of other ways that we can engage with this particular group. And I think we've got a fantastic opportunity at the moment. We've got primary care networks which are all starting. We've got actually groups of practices who may be able to deliver some of these services. There's no reason why these can't actually be done in pharmacies or places where other people might go. So I think there are ways that we can actually try and capture some of this population so that they're not actually dying 15 to 20 years earlier. So I think we've talked about this really, and I think I've just put partners up there. What I mean by partners are really non-clinicians. I think there is actually probably, people don't know that there's a risk here with people with mental health illness. I think there's a lot of awareness about mental health at the moment, which is fantastic, but actually we also need to raise the profile that we can prevent people with mental health illness dying early. So it's really just using some of our partners, some of our social prescribers, some of our comms teams to really just to support people to, one, know about it, and two, to access the right services. And that's it.
Thank you very much. So we have time for questions. Yeah.
On a slightly different note from the severe mental illnesses or serious mental illnesses, I'm having a few sort of teenagers come through on antipsychotics, and obviously the risk of antipsychotics increases the cardiovascular risk. Should we be doing, they're obviously quite young and they might not be on them for that long, hopefully, but should we be doing some of these checks on them? Or I have had letters from the psychiatric team asking for lipid checks and ECGs and things. I don't know if you've got a view on that.
Well, I've got a view, and I've got what is currently in the pathway. So at the moment, what I've just described, you're right, is from 18 plus. However, as we know from most not just mental health but physical health problems, actually the earlier we can start with some of this, the better. So I think really from that point of view, I'd say it would probably be good practice to do it. Unfortunately, it's probably not funded. It comes down to the funding, really. So that's something I don't mind going back to and just saying, what about children and adolescents on antipsychotics? I think that would be a very good thing to take back. With regards to screening, I just want to, there are some guidelines in Buckinghamshire for those who are antipsychotics, actually slightly different to this, because I think there's been lots of controversy about, should we be doing ECGs, should we be doing prolactins, what else should we be doing and how often? And I think you'll probably be familiar with those letters. There are some shared care guidelines which have been agreed by the Meds Management team and also with Oxford Health. And actually it's very simple. Most of those screening tools are done at diagnosis and in the first year when patients are generally under secondary care. When they're under secondary care, it tends to be done on an annual basis, and it's actually very similar to the health check that I've just described. So it's not actually looking for ECGs and any other blood tests really. So that would be something to look at.
Other questions? No. Thank you very much. Thank you. Yes. So we have the last presentation about other mental health resources. You want this mic?
Is this on mic? I have a very loud voice too, so... Okay, last session. So I'm Ina Wolsey. I am the IAPT, Thames Valley IAPT SEN lead. I'm also the Anxiety and Depression Network manager. It's all a terrible mouthful. We are hosted by the Oxford Academic Health Science Network. Basically, we work very, very closely across Thames Valley and Milton Keynes with all the IAPT services to continuously improve patient outcomes at the end of the day. That's what we concentrate on. I have only 3 slides for you today. The first one is one where I have looked at particularly what e-learning mental health modules are available right now that you might want to tap into, and just listed them. I don't expect you to, and you can't in fact read this, but it's really for your reference. It'll be in the slide pack. So the BMJ has quite a lot of modules of either 30 minutes or an hour. And there's an interesting, fairly new one on anorexia nervosa in childhood and in adolescence. So that's around the recognition and initial management in primary care. And it's a highly practical one. It also gives you some ideas on putting together a diet for a youngster whilst you're waiting for the referral to come through and all those sorts of things. So I think it's a 1-hour module, well worth taking a look at. It also helps you look at and identify any red flags that you might look out for with your youngster. There's another one on asking women about domestic abuse, very much around becoming more aware of the prevalence of domestic abuse, also around health consequences and how you might offer help to women in particular. There's a 1-hour module on the patient's journey, which I think is quite an interesting one, because it's really around helping patients understand their journey through mental health care. Now, that does differ a little depending on where you practice, but there are some useful tips in there. The BMJ also have psychosis and schizophrenia guidelines module there, which is quite important to look at as they've just been revised. And they have a module on generalised anxiety disorder, your GAD, what if patient, and distinguishing it from different anxiety disorders and how you might manage it in primary care. So they're all part of the BMJ offerings. Another one is around, it's just a 10-minute consultation on complex grief, disturbed grief really, people who don't seem to be working through their loss within a 6 or 12-month time frame, and you might want to look at what might sit behind that. It's about 10% of people who are in that category, and how you might manage that in primary care. And there are lots and lots of modules there on the physical activity, so in anything from diabetes to depression to anxiety, and how you might talk about that with your patients. So lots of good stuff. I've given you the link on there as well. The Royal College also has lots of modules between 30 minutes and 3.5 hours. It includes alcohol, and particularly the management of alcohol issues, obviously in primary care, and different ways of helping people. It's a free course. There's interesting and good material there as well on consultations with young people, and these have been developed by Dr. Marianne Freer, who works for the Charlie Waller Memorial Trust, and lots of useful stuff in there around having conversations with young people in primary care with mental health problems. And then there's also quite a lot around suicide prevention on the RCGP site, and I've given you the link to that as well. Another one I've mentioned on here is a fairly new module that's been developed by Health Education England on gender variation, which I think gives you quite a lot of good insight into what I think is increasingly becoming a topical issue. It's about 45 minutes. And then Future Learn, there's another link I've given you. They always have slightly different topics and courses on Future Learn. There's quite a lot around mindfulness and well-being, so in terms of looking after yourself and that kind of thing. Dementia care is also on there, and particularly looking at living well as dementia progresses, and you as a clinician being able to help carers to think around how you might help people live well as their dementia progresses and how you might be helpful in that process. So if you do nothing else ever, you may want to refer your patients to the MindEd website. Do people know about MindEd? Absolute treasure trove of really useful stuff on there. Lots and lots about young people, but also about older people, and it's for professionals as well as young people themselves. So there's lots on there that's very, very useful. So if you don't do anything else, have a quick look at that and hopefully use it in your practice. So that's just there for you for reference to have a look at when you might think about what else to do. I have 2 more slides to show you. These are training programs that are offered through my network, if you like, because it's Thames Valley wide. One is for adults and one is for children. The first one is called PIP Care. I don't know if anybody's had any experience of PIP Care modules. They are Royal College of GP accredited training modules. They're free of charge. They're delivered by your local IAPT staff. So we train up IAPT staff to deliver these evidence-based PIP Care modules. There's really 2 buckets of offerings there. One is a set of skills and tools that you might find useful. So anything from motivational interviewing to the principles of behavioural activation, how you might prevent someone from slipping into a depression, to detecting anxiety and depression, also in older adults and what that might look like, guided self-help, problem-solving techniques in depression, very, very useful to know how you might do that. So those are kind of skills, and what happens is that we will come to your surgery to do these teaching sessions. We'll come and do a 10-minute session if that's all you have over a coffee, or we'll come and do it over lunchtime, or we'll do it over a longer period of time. So those are skills-based. The other one is called 10-minute CBT. They tend to be a bit longer, and we use specific training DVDs for that. And that really takes you through the structures that you might use for your 10-minute consultations. So the training DVDs are on either mental health or physical health and long-term health conditions, and also around health anxiety and persistent physical symptoms, or what we used to call MUS, medically unexplained symptoms. So that's more intensive. We would need more time to do it. We take all GP trainees through quite a lot of these in Buckinghamshire, in fact. And it just gives you a framework to hang a consultation on that's only 10 minutes long. And they're all CBT based, and can be very helpful, I think. So what I've got is, there's the adaptation, 30, 60, 90 minutes each, 10 minutes, whatever you've got. Your IAP staff will call in and run a session for you. So this is the adult version. So the PEP Care has already been mentioned this afternoon. PEP Care is the same model, if you like. We train up experienced camp staff to deliver PEP Care sessions. And all these modules are evidence-based. They've all been developed by leading experts in the world. Similar idea, you can contact your local CAMS service. They will come and book in sessions with you. We run lots and lots in schools as well as in primary care. The overarching objective really is around feeling more confident to open up issues around distress with young people. Similar kinds of things that are on offer, from specific phobias to, sessions that we run a lot are around behavioural problems, self-harm, and eating disorders and anxiety and depression. Those are the main ones that are run. But we can also run them on PTSD or more sort of specialised subjects. Again, they're all adapted to whatever you need or want. And that's PEP Care for you. So, e-learning, PIP Care and PEP Care is all I'm going to cover today. And your last slide will give you contact details. You can always contact me about any of this if you want, but we do have specific contacts for PIP Care.
that are on the slide in the slide pack, and for PepCare, probably easiest to go through me. Ridiculously long email address, but it does get to me in the end. And I'll point people to the right people to contact. And I think at this point, that's all I'm going to say, but presumably you want to say something about evaluation or...
Yes, yes.
So, just want to say thank you all for coming, and in particular, perhaps we could all thank particularly Andrea for all his support and really good chairing, ending on time after all that confusion. So, thank you very much, Andrea. And just to reiterate, if you could fill in your evaluation forms, it's really important for us because it helps us create the next agenda for the next one of these sessions. We've got a regular timetable where we'll be doing these a couple of times a year. So if you say what you'd like to hear about, we'll get the speakers to respond to that. Thanks again. Thank you very much.
Yes, please.